physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to treat a muscle strain or tear in the quad, hamstring, or thigh adductors.
Kind of like your upper leg.
Right, well the muscles that attach into the knee.
Yes.
So the thing is, a muscle strain occurs when one of the muscles gets stretched or it gets pulled beyond its limit.
Yeah, and you get some tears in the tissue.
You can get a tear, a strain, they call it pull.
Yeah.
You know, they have a lot of different terms for the same thing.
Yeah, one way or another, it hurts.
Right. And as a doctor or a therapist, you might even give it a certain degree. There's 3 degrees. The first degree is sore. The muscle was just pulled. You know, it wasn't really there. There's no tearing. It's just mild overstretching.
Sure. They may call it micro tears, but whatever.
Sure. In the second degree, you have a lot more pain and some swelling. You're going to have some overstretching of the muscle with some tearing, like you said, micro tears possibly. Now, third degree is severe pain and swelling. This is where the muscle or tendon is torn all the way through. So this is surgery.
And you're limping pretty good.
Yeah. If you're even able to walk.
Yeah.
So, and you can strain your knee, especially when you get older, our age, just from everyday activities. It doesn't take much.
It really, yeah. I remember taking off running once in the spring because I hadn't run all winter. And I've always done that. And all of a sudden I get in my 50s and it's like, I get sore and I get strain in my groin muscle. Like I never had this happen before. Anyways,
things for you to look forward to if you
go.
haven't already. So you have a higher chance of experiencing a knee strain if you've had a prior one, if you heard one before. You have tight muscles.
Yep.
Makes sense. You fail to warm up before an athletic event or a work event.
Sure.
Or you attempt too much when you exercise or work.
Too much too soon.
Too much too soon.
Right. Yep, that's a very...
So the signs and symptoms, swelling and bruising, generally when there's bruising, it's more of a damage has been done.
Yeah, so it's like you'll see, you know,
discoloration.
It's called ecchymosis. In other words, blood is in there, but it's like you didn't have trauma.
Right.
In the sense that you had a physical bang there. You just had the muscle
tear.
Tore. And the muscle starts to bleed as a result.
Your muscles could spasm because they're trying to protect themselves. If you, like I said, signs or symptoms, if you had a previous strain or tear, if you can feel point tenderness, it's real simple. You know, a lot of the quadriceps tears occur like mid-quadricep. So if you poke around and you find a real tender spot in the middle, maybe a minor tear or a major tear.
And sometimes those aren't always easy to find. I know I do it when I do that. I get a system. I'll start and I'll go down, then I'll move over and I go up, and then I'll find a specific spot, even though you may not feel it right there.
We're going to be showing the massage gun ladies, and they often will find a spot for you.
Yeah, that's a little easier.
Yeah. If there's pain when the muscle is used, or there's weakness when the muscle is used, that's a sign. And you don't believe in this one, Brad, but hearing a pop sound when the muscle or tendon
I do. I just
injured.
Always question it a little bit. Depends who heard it, how far they are away.
So we're going to show you 4 self-tests you can do for these muscles. One, you can do what we just talked about. You can try to find a tender spot. So if you find a real tender spot, there's usually something going on.
Yeah.
And we want to work on that tender spot. 2, let's work on the quadricep. So to test the quadricep, it's going to help if you have someone with you. I'm going to do it on Brad here. I'm going to check his left quadricep. You go ahead and straighten your leg, Brad, and very simply, I'm going to push down and you resist.
Yep.
And I'm going to push hard because I want. And if that hurts anywhere along up in here, you may have
a normal quad for especially someone active. The tester should be able to push as hard as possible, and it should not create any point tenderness.
Hamstring, same thing. It can happen in the mid hamstring, or it can happen way up by the sit bones where it attaches. So you can go ahead and bend the leg, and I'm going to go ahead and I'm going to try to pull it straight.
Oh man, Bob, look at those muscles bulge on those forearms. Popeye.
Taking on your big hamstring.
Yeah.
You can also just push the heel down into the ground.
Yeah, you can kind of do that one by yourself. Yep.
Yeah. The last one for the hip adductors or the thigh adductors, you just put your hands or your fists in between your thighs and push them, squeeze them together.
Now, some of those muscles don't cross the knee and some will cross the hip. So you might, but either way, it's going to be painful and you need to find out where it is.
Right. So treatment is, we like to do cross fiber massage. You can use your hands. So let's say the quadricep, it's in the mid quad like we talked about. You can work around it a little bit. I like to go across, the fibers go this way, like this stripe does. I like to go across the fibers. And, you know, the problem is fatigue. Yeah,
especially when you get older. It seems like my fingers fatigue easier. But the other thing is, to do this, you're not doing superficial.
No, you're getting in there.
You have to get into the muscle and work it. And that even fatigues the fingers faster. Like, you know, I'm doing here, I put both of them on together, which is...
You probably want the knee straightened. They'll relax the muscle more.
Sure, I know what you're saying.
But you can start by doing this. If you can tolerate going right over the spot, go over the spot. If you can't, work around it.
Yep.
But what's going to work much better is a massage gun. Here, Brad, I'll give you one.
And it needs to be a massage gun that doesn't just vibrate it. It has to
have percussion.
Yeah, reciprocate back and forth, and you're going to use
travel.
That.
Yeah. And, you know, all these massage guns and the ones that, you know, we like Bob and Brad's massage guns, but they have 5 different heads and 5 different speeds.
Yep. So
you can really get quite intense with some of the heads, especially the one that Brad owns here. That is a screw-on stainless steel head.
Right.
Now that one can really get aggressive, and these are big muscles, so sometimes they can tolerate it.
Right, and it's an individual thing.
Right. Right. So I would start off, if you use the massage gun. Now I would definitely start off around the painful area. I wouldn't go into the painful area right away. I'd just work into it.
Yep.
I'd start around it and then slowly work your way in.
Just be careful when you get around the kneecap or a bony area. With these guns, you want to be. That's not going to do any good to massage your bone, and it's going to hurt.
And I have no qualms whatsoever, Brad, about recommending a massage gun because, you know, the thing is they're a little bit pricey, but the thing is you will use these your entire life.
Yeah.
I've given away probably 50 of these now.
Really?
To friends.
Wow.
Yeah, I want to make sure they stay my friend.
No, it's true. Because if you've got other people in the house, they're going to take them and use them as well.
Exactly. And you can do the cross fiber. And Brad likes to use the round head.
Yeah. Not that I'm a round head, but yeah. It really offers some good control. You can see I'm doing this one sideways because if I go use this one directly on my quad, it's a little, my quad muscle's not thick enough, and it all depends.
So
I definitely like it on my hamstring.
I'm surprised how that feels on mine.
Good.
Wow, I think my hamstring maybe needs this.
Yes, the old hammies.
Oh, on both of them.
But,
So, and then you can hit the thigh too, you know. So again, rule of thumb, you're going to start around the painful area. Eventually, you get to the painful area and go across the fibers if you can and work it. You can do this like 15 minutes 3 times a week or 15 minutes every day. You can split it up. You can do 5 minutes at a time. But this, you know, it's just a good investment. What else can I say, Brad?
Well, I don't know. We could talk about making cookies, but I think we should stick to the topic.
All right. So this video is part of a series of videos on treating knee pain. So if you go to bobandbrad.com, bobandbrad.com, go to the program section, and you'll find one on knee pain, and check out all the videos. Watch the ones that pertain to you.
And then you can click on the PDF, print out a real, like this one has a really nice, looks like 2 or 3 pages of review and the exercises, the tests. So you really can't go wrong. There's a cost, Bob. It's a big fat zero. It doesn't cost you anything. We don't even ask for your email. It's really a deal.
You have to send us good vibes.
There's nothing else out there like this.
Right,
I think.
right.
It's one of a kind.
Thanks.
Be careful.